And I need you to believe that, yeah. And then. Your text came at the very same time, so.
Mondays are just,
Yes.
they're just chaotic. And everything in the world that could go crazy goes crazy, yeah. Especially in the septic business.
This is everyone, Dr. Pearson, who will be here.
This is it?
Yes.
All right. Woo.
This is
Here
your
we are.
forum.
Okay, well, I guess I will call the meeting to order. Our first order of business is approval of minutes. Give everyone a few minutes to review.
Is the newspaper lady here today?
Not yet.
Because I kind of felt like I might have been misquoted in the paper with that article. Something that I said, but yeah, but
She's usually pretty good about it. If you contact her.
it wasn't as bad as sometimes I've been misquoted that I've really done things about. But I just thought, if that's what I said, that really wasn't what I was thinking, but anyway, so.
I didn't read the article, so I'm not even.
Yeah,
Didn't either,
it
so.
was an interesting article. Most people aren't getting the paper anymore.
I get it digitally and I go on there and read articles.
Yeah.
But I don't do it every time it's posted.
Twice a week.
Yeah.
I'd make a motion to approve the minutes if everyone.
Second that.
All right, all in favor? Aye. That is unanimous, so the minutes have been approved. Our division reports.
Seems like our fatal overdoses are in line with what the country itself is reporting with a substantial decrease. It's
Very
encouraging.
good to hear. Yep. Very good to hear.
I say the sober movement is extremely in full force. I think a lot of people are getting sober and then encouraging other users to also get sober. And I know I've seen a lot with the FRC court. They are doing great work getting families. And it seems like people are really starting to wake up a little bit and realize that, it can be you too, you're not invincible to this, so.
I think the peer support specialists are huge.
Yes.
Huge. Somebody that's been there, lived it.
Yep, been there, done that, fell off the wagon 10 times,
Yeah.
came back out of it, yeah. Yeah, the peer support has been great.
Are there any other high or low points anyone would like
One of
to
the high was
point out?
Panna Donuts and Starbucks. They're both new in town.
Yeah.
I was gonna hit a few things just when I.
Okay, sure. I did have some questions in regards to the change. Of course, I would have this concern, change in animal bite reporting. Can you guys kind of elaborate on what kind of a burden that's going to place, or how much additional training is going to have to be?
It's a part of the bigger picture where the state has withdrawn, well, because of federal cutbacks, it's trickled down to the state. And so we're picking up a lot of tasks that the state had handled a little more robustly. So the animal bites will go to environmental. I think nursing had helped some when there was such a backlog. And Jeff has been working closely with the hospital and all facilities. They need to fill out a paper very completely because all we have is the paper and we have to track down the ID.
So was it our decision to route that to environmental instead of nursing? That was a state.
Yeah, when I worked in the environmental division, we always did animal bite reports. I mean,
Okay.
we didn't do the report itself. We received the report from different agencies, whether that was Marion General Hospital, the Med Express Clinic. Sometimes people would come in and say, hey, I got bit and I need to fill, they would fill out a form in my office. But we would typically get those like either fax or emailed. And the forms were sparsely filled out.
Populated, yeah.
And then because they were emailed or faxed, they were crooked and or it is. I mean, technology's gotten a little bit better too, but they were horrible to try to read. So yeah, you would try to contact the person who got bit, try to find out if they knew who owned the animal that bit them, or a lot of times it was stray dogs or a stray cat, or they tried to rescue it and it didn't want to be rescued. I mean, so there was a whole lot of different scenarios, but I worked really closely with Animal Care and Control, the Marion Humane Society. I mean, I don't know that it's gotten any better in the 8 years I've been gone. It was bad then, trying to.
I can give you actual numbers. In 2024, we had 55 animal bites at this time of the year. Year to date, in 2025, we've had 46. So
it's not a small problem.
It's not. You're looking at probably over 100 cases
a year.
Yeah. So how many of those get submitted for rabies?
I don't think many.
Not very many.
Typically, the only time anything gets submitted for rabies is if it's a bat.
Yeah.
And we're not sure if it, because bats are small,
Sure.
and easy to box up and send on.
And for what it's worth, bats are the primary source of rabies in
For all
Indiana
other
anyway.
animals, they have to be decapitated.
I've done it a couple.
Yeah, so typically it would be animal control that would decapitate and bring us the already boxed up head, and then we would ship it off, and
And never hear any results?
Yeah, we always got the results back.
Oh, well, that's good.
Yeah, we always got the results back. I think in my time working, we had 2 or 3 positive rabies bats. But I don't recall any cats or dogs ever coming back positive for rabies.
It would be a sick animal that didn't have proof of rabies vaccination.
Sure, right. I mean, there are definitely protocols for who should and who shouldn't be submitted for rabies.
I had a case that I actually talked to Dr. Moore about because it was my patient. And he did the research and said there hasn't been a case of rabies in a cat in Indiana since like 74.
Yeah.
And so, it was like.
And I think,
And
it was the
early
late
80s for a
50s or
dog
early
and-
60s for dogs, so, vaccination works. So, okay. Let's see, any other discussion on environmental reports? Or any other division reports?
Sounds like everybody's really busy with things.
Yeah.
So you're offering CPR training.
Yes, excited for that, for the new year, school year, new school year.
No, there was no small feat to get a trainer so she could be trained as a trainer
Oh, yeah.
because they have a capacity and nobody around here could do it. So it's been a long time coming.
Yes. Yes.
Was there a reason we pulled out the alcohol, substance, tobacco abuse for studying natural deaths? Just curiosity.
Just to see how much substance use was a part of
Uh-huh.
a premature death in our county.
Yeah. And premature is defined as,
Well, we're well under the state average. You know, it's like 77 and we're 72.
Oh.
So we die younger. We just wanted to capture, because my experience in the office says lots of people smoke, lots of people drink. We just wanted to have some tangible data.
oh,
And it's on the death certificate, so it's not that hard to glean.
a lot of heart disease.
Probably a direct correlation with all the smoking and everything.
Yeah, just trying to get a grasp on why we are at the bottom of the state. You know, I take that personally after practicing here for 15 years. I wasn't surprised because it was what I was seeing in my practice. Like these people just keep getting sicker no matter what I recommend or what care they get and just why. And a lot of it's just, well, a lot of theories, but so many of my seniors are so busy worrying about their adult children who have fallen off the rails that they care less about their own. And they're raising their grandkids and it's just,
Make a motion that we accept the health department division reports.
I'll second.
Okay, all in favor?
Aye.
Thank you, they are approved. Okay, Dr. Woods, you're up.
Okay, well, I think everyone's aware that Health First Indiana will cease to exist in the way we've known it for 2 years. In all the budget talks, the amount of money that was going to be allocated for Health First Indiana just kept getting chopped and chopped and chopped. So we're down to 29% of what we were given this year. In 2024, we were given $804,000 as the first year. And then in '25, it was 1.55 million. In this coming year, we'll get 415,000, which is 27% of our funding from last year. So what's happening is, services that were being offered won't be able to be offered. We've done a lot of work with community partnerships because the vision of that when Governor Holcomb and Dr. Box and Dr. Weaver came up with Health First Indiana was providing services that aren't a part of the normal healthcare system. They're not services that are reimbursable by insurance. Because we know the traditional way of practicing medicine isn't keeping people healthy. You know, you can't get well on an 8-minute doctor's office visit or 15-minute visit. So part of our community partnerships, we're doing these things that had coaching and education and spending an hour or two with a dietitian, learning how to eat and cook. So we formed these wonderful relationships, but now there won't be anything in our proposed budget for community partnerships because there's absolutely no money for that. And we've already let the people we've partnered with this year and last year know that based on the cutbacks from the state, there won't be partnerships. So they can start looking for how they're going to finance for next year.
The same program that they've had, they just won't be getting any funds for us.
Right,
Okay.
yeah, so we wanted to give them a heads up so they can start finding, not count on the health department for the partnership monies.
I think it's unfortunate because, part of what Health First Indiana allowed the county to back away from their financial investment in the health department, and now that money's been pulled, and I'm guessing the county is not going to come back in and
Yeah.
support us at the level they did
No.
prior to
No.
Health First Indiana.
Yeah, and when Tara talks about the budget, she will talk about those numbers, but in essence, we're asking them to give us what they gave in 2023. And if that's approved, with those monies and HFI monies, we will be functioning on a 56% budget of what we've had this year. So we're making significant cutbacks in what we're offering services. So we're hopeful, we don't know, that the process for the budget is we have to submit, like in the next week or two, to the state what our proposal is for our budget. Because they're really interested in how we're gonna spend the Health First Indiana monies. But the county won't, they'll start budget hearings in August, but they won't address personnel issues in budget until October. So even though tonight we need you to approve a budget, it's October before, and the council could change everything, we don't know. So you're approving something tonight, but there's a lot of, well, the council of 9 people, 9 councilmen, 7 councilmen, will have the final say in the overall budget. And that won't happen. County council won't happen until October. So in addition to cutting back our monies, the state has stopped doing a lot of things. The lead testing is fully on the environmental division as far as the testing of the property, but the nursing does the case management. So that's going to involve both divisions working together. And then we talked about the animal bites. Also, typically the state would be sending out right now vaccine letters to all children in school that need updated vaccines, and they're not doing that. So that's falling on the school to get the message out to the parents that their child is deficient in vaccines. They also were tracking some of our less common communicable illnesses like waterborne and zoonotic and other infections that we don't deal with. They were doing that for us. They had a group of, were they experts?
Students.
Okay, but they were focused on that was their job. Now that's all back on our communicable disease nurse to be tracking a disease that may show up once every 3 or 5 years. So there's the weight of that, and they are offering some training to help do that. But yet it's just, besides losing a lot of money, we've had things that we have to do that we weren't responsible for. One thing they've taken away though, and Tara can clarify, the smoking is being taken away from the health
Tobacco prevention.
Tobacco
Right.
prevention is being taken away from the health department.
And given to?
It's in the wind.
That was supposed to be what they were telling us was a good thing that we don't have to do, and we're thinking that's a huge part of our health issues. But they were celebrating that for us, that we don't have to worry about that anymore.
And in fact, we are not allowed to spend Health First monies on tobacco prevention. We're not allowed to.
So,
Was there, and again, politics are so right now, but was there any indication that there would be this kind of cuts? Yeah, I'm trying to find a nicer word to say, but yeah.
yeah, I specifically asked Dr. Weaver when she did her 92 county tour. She was sitting right there. And I said, this was in August of 24, yeah, and I said, we're doing all this stuff, what's the likelihood this is gonna continue? And it was like, oh, we told them it's a 10-year program, we're not gonna see any change. it's not a 2-year deal, and, it was very affirmative that, yeah, this, we think it's gonna just go right through, but that didn't happen.
Yeah. Okay.
So is it easy for families to figure out what vaccines their child is needed, or easy for a school to figure out what vaccines are needed?
It's easy for the school to figure out, to go into CHIRP and they can run a report for the students that's at their schools that need their vaccinations. So it's easy, and they typically do it anyways. When I was a school nurse, I didn't even know the state of Indiana sent out letters or whatever, but they'll get on it as soon as school starts, so.
But not before school starts, so they'll come unvaccinated potentially.
And they can call the health
Potentially,
department,
yes.
right? The phone
Yes,
rings.
they can call us and we can print a report
Okay,
and schedule an appointment at the same time.
And their primary care, their pediatrician or their primary care doc can do that also as a part of their wellness.
how many vaccines are now required to start school?
Oh my.
Too numerous to count.
It's too numerous to count, okay.
And I think they said they were going to try, since they weren't sending out the letters because the postage was expensive, they were going to try and do like email and texts. So the school or the state.
So there might still be some sort of notification that goes out, just not paper letters.
Not email.
But that's only if
Okay.
the information we have in CHIRP is correct.
Right,
A lot of times they don't give us real phone numbers.
or the emails are spelled wrong, or,
Uh-huh.
yeah, I get it.
And it might change the workflow for the nursing division, because my understanding from Jane was that a lot of the vaccines started happening earlier in the summer because people knew they didn't want to wait till right before school, but now they might not have that awareness, and so it could push the rush for vaccines once school has really started and people are getting, behind the 8 ball, that they need to have that done. So we'll see. What we're learning is we just have to keep flexing in whatever way we're expected to. So, we also, just because of septic issues, we have created a flow sheet that when the environmental division goes on site, or if somebody shows up.
You haven't?
Yeah, if somebody shows up and says they think they have a problem or a complaint has been filed against them, they're given a piece of paper that's a flow sheet, like this is what might happen. Because what was happening is they were hearing worst case scenario and not hearing that there were many steps ahead of that. All they're hearing is you need a new system, period. And they were freaking out because that's expensive. And so we want to, so that there's no he said, she said, they're going to give the citizens this paper that spells out what the standard protocol is for all cases. And so there won't be the question. So you're free to look at this and we thought it'd be a helpful tool just so we can document if there's a file that this sheet was given. So we're protecting our staff from allegations of things that weren't said. I don't know about any other stuff you guys are doing with the cleanups. The other thing, our director of nursing resigned. Jane resigned. Her husband is ill, and she took her FMLA at our encouragement to not, but her time lapsed, and she just felt like that it was best for her to resign. So the job's been posted, and we've had candidates, and we're looking at interviews and all.
I'm so sorry, I missed that. What position is that?
Director of nursing,
Oh, okay.
yeah. So we had a group meeting Thursday. The whole department was together, and we wished Jane well and thanked her. And we'll miss her presence and her commitment to the county. She's doing what's best for her family right now.
She is gonna stay on part-time with us, just when she can and yeah.
All right, thank you. Sobering news. Is there any old business to be discussed? Okay. New business is our budget.
Yeah. I'm gonna do it from my seat though, if that's okay. Sure. So you'll see, it's retaining all of the same positions that we currently have. No pay increases, just same pay rate. And it shows a negative balance of $102,759 when we make the cuts that we feel like we can and retain all of the current personnel so that we don't have to cut services more than we already are. We do have some carryover funds totaling about $300,000 from different accounts. Some are from the local health maintenance grant that we used to get and the tobacco trust. Some of it's some leftover carryover or COVID money. So for year one, we just discussed it and decided that we would use $100,000 of that carryover money. The state has to approve however we spend the carryover. I'm 100% confident the state will approve us using it to continue offering the programs that we are. So that's what we're going to ask them to do. We are asking for $238,000 more than they gave us this year. We're just going to ask them to match what they gave us in our 2023 budget. I don't know how that's going to go over, but that's what we're going to ask for.
And that's still 56% of what we had for this year.
So what is the plan when we run out of money?
Well, I would suspect one would have to go through and see what we don't have to do that we are doing.
And there isn't much, is
And
the
there isn't
problem.
much.
There's not much.
Right, I mean, Brandy knows when she was there, I mean, we do everything that's expected and very little more because we don't have the staff or the funding to do more than the state already requires. The requirements went up under Health First Indiana when the funding did. Now the funding's gone, and to say you took tobacco prevention away so you've balanced that out is not fair or accurate at all. So at this point, we are going to try to not cut any staff, therefore we don't cut services.
What we had talked about is if people leave, not necessarily rehiring, but doing some restructuring. In some counties, environmental and food are cross-trained and do each other's jobs. So we're looking at
How we can cross over, I
how we
think.
can cross over and then probably not fill positions if people end up leaving.
So what did we do with our medical waste removal before?
We just contracted with a different company.
Because the county never had any funds, so
It was under a different fund for the county. It was, no, I'm sorry. It was paid out of the local health maintenance grant, which I didn't submit the paperwork for that in this budgeting. It was paid out of a different grant that we forfeited when we signed on for Health First Indiana funding.
Now you can't get that one back.
No, they aren't giving that back. But what I was told was that was $48,000 compared to what we're still giving you, so. So medical waste was paid out of a different grant previously.
yeah, and the other option is looking for other, public health grants or something. smaller ones, maybe just for a particular issue. I don't know when we find them or not, but I know there are different groups of people who are different grants going out there. But, I mean, that's just a pain too, because then there's all that reporting. But the reality of it is, as cynical as I am at this moment, it was unrealistic to really think that this health fund was such a great program and I loved it. But to think that if somebody new comes in that doesn't have that vision, when a new governor comes in, a new person comes in, things change. I mean, new president comes in, things changes. So, yeah, it's the pits that happens.
Yeah, and I think, they found that huge deficit with Medicaid, like $2 billion.
Right.
It's like,
Right.
so trying to make up for that, so
And
they cut everything else.
they don't care as much as we do that we are 89th or something out of the
I'm
state.
pretty sure we're 91st now.
And, they
Last
don't,
time I looked.
whatever number we are, I mean, the state doesn't really care who you are. So we're the ones that care that this is happening and trying to figure out how to navigate. It's hard, just hard and not fun. Yeah.
I don't know.
Yeah.
Just not very fun to be a basement state in the basement of a basement state. It just, wow.
Are you finding that staff stress levels increase as you're talking about understandably no pay raises and having to maybe absorb other positions as they're cut, or what are you noticing as far as the culture?
The lack of pay raises, I don't expect, because the county gave generous pay raises for 2025. 2025.
Much more than we were gonna ask for.
Much more than we did. Yeah. So, I don't, and people that have worked for the county very long know that you're not gonna get raises every year. And they hear the rumblings that the county is short too. So I don't think any county employee that understands how the county functions is gonna be surprised about the lack of a pay raise. The rest of the rumblings, I mean, all you can do is tell them, this is what we're working with, we're trying to make this happen, this is the process, and we'll let you know when we know.
Yeah. So you want us to approve this budget as it's distributed? I'll make that motion that we approve this 56% cut budget from 2023. You don't have to put that in my.
Or in the paper.
No, or in the paper.
Now you're going to paper.
Unless somebody says maybe she's there online.
The meetings go on the YouTube page after they're over. Did you know that?
Do they?
I don't think too many people watch that.
I don't either.
It's not as exciting as some
But,
of the
I mean,
other
what I
ones,
said
you
is
know?
true, so, I mean, that's the truth, that's compared to 2023, it's a 56% cut.
I'll second.
Just any discussion? I just would like to say myself that I think you've done a wonderful job trying to preserve our priorities here as best you can, in spite of what seems a very shocking to me anyway, situation. I totally did not anticipate this amount of sacrifice that we're gonna have to make. So, at any rate, with that in mind, I will call for a vote. All in favor? Opposed? Yeah. The motion passes. We will accept this budget and send this on to the county. Thank you.
Is there, I'm so sorry, it's a little late to ask this question, I think, but, was there any, what was it, the ARPA funds or something like that?
None.
Okay, I knew there was stuff had gotten figured out, I just wasn't
And
sure.
the opioid settlement, is that, no, now we did learn that because Core Plus is someplace that we've supported pretty substantially over the last 2 years. I did tell Kelly, you know, that the city of Marion has hired this specialist and, yeah, consultant, make contact and get your name in there real quick and.
They have $1 million. The city
Consultant
has $1
for what?
million. So,
Oh,
from opioid settlement.
from the
Oh.
addictions
So they can,
consultant.
they hired, they're paying $30,000 for a consultant to tell them how to spend this $1 million.
You know how I feel about consultants.
That was
Well,
the-
don't they have to spend it on something opioid, or are they gonna spend it on snowplows?
No, it has to be, it's opioid settlement, and that's, they have to spend it very specifically. So,
So that would be like what we're doing.
Miss Jones? Yeah. How are you,
There's a
honey?
meeting at 6:30. That's what it
Good.
is.
Is that, oh, they have another meeting
There's a
coming
meeting
up?
at
Okay.
6:30, yeah. Next Thursday.
Sorry, we're still in the health board meeting, but you're more than welcome to sit in. It's a public meeting.
So the Core Plus and those things could be funded through that.
I'm sure they could,
Yeah.
yeah.
Yeah, so that seems to be very pretty successful.
Do we have any other funds?
No. No, we had the tobacco trust and the local health settlement, local health maintenance, but those, if you accepted HFI, you forfeited those.
How many counties did not accept HSI?
None of them, I think they all accepted it.
In the first year, there were a few that didn't, but year two, everybody did.
that's kind of a bait and switch.
Yeah,
It really
no
was.
kidding. Those were the exact words running through my head. This totally feels like a major league bait and switch.
And then it was like, they were surprised that we were surprised. I know.
Nobody campaigned on dumping public health.
I
Nobody
know
did.
that, was the SB1, is that the one that did all the cutting? So that was in the works for a while because I was getting email after email after email telling me to contact my governor and we did. There was a whole bunch of people I know that went to meetings, stood up there and fought and it still, they signed it anyway. So I guess, he's not looking forward to being governor after this 4 years because I don't think with this, he's going to be very popular.
Yeah, and it's, it's not just us, but like families with disabled children, the Medicaid waiver process it's still present, and you can wait in line for years. And many people have been affected, and everything's been cut, so.
Yeah, it's all across the
Yeah.
board.
Hopefully the pendulum swings back in the right direction here soon because
But if we're in debt, at one point there was just all this money flowing and now all of a sudden it's like, where did all this money go to?
That's the good question.
Those are the questions that have to be asked because they weren't doing this Health for Indiana plan without having a big stack of money for 10 years we were going to spend. And now all of a sudden it was like, by the way, we're in debt and we can't do anything really right now. And it's like, and all your
Somebody
tax.
needs to hire a new accountant or something because somebody ain't doing that right.
I think it's so convoluted how they do it, and then that just adds to.
Yeah, definitely. All right, ladies.
All right.
Yeah, it's been fun. It ain't been real fun.
any public comments? Since there's no public, I guess. Yeah, we have public.
Thank you for coming.
Yes, thank you for coming.
Officially?
Yes, I would
Need a motion to
for a
adjourn?
motion to adjourn.
I'll motion adjourn.
Okay, all in favor?
I'm the only one who has to say something, right?